My name is Lannis Hall, and I'm the Director of Radiation Oncology at Siteman Cancer Center and Associate Professor of Clinical Radiation Oncology at Washington University School of Medicine. Hazelwood School District and Siteman Cancer Center have partnered to present information on breast health for the Hazelwood East, Central, and West young ladies. Today, I want to share some of the high points of our breast health program, including early detection information, exciting updates on the prevention of breast cancer, and helping your students' high school win the grand prize. First, let's start with the facts. Breast cancer is the most common cancer diagnosed in women and the second leading cause of cancer death. This year, approximately 286,000 women will be diagnosed with breast cancer. And although we have made tremendous strides in the screening and treatment of breast cancer, all women have not benefited equally. African American women have a 40% higher mortality rate than white women in the U.S. In some regions in St. Louis, the mortality rate is 90% higher for African American women than white women. We know we can improve this horrific statistic, and we are all in this together. So let's begin by discussing the screening guidelines for breast cancer. The National Comprehensive Cancer Network, the American College of Radiology, and the Society of Breast Imagers state that women of average risk should begin screening at the age of 40. Siteman Cancer Center also recommends starting at the age of 40. Screening includes a mammogram and, ideally, a visit to your healthcare provider to discuss how to reduce your risk, update your family health history, and complete a clinical breast examination. Women who are high risk include women with a known change in a gene that increases their risk for developing breast or ovarian cancer, a close family relative with a known mutation for breast and ovarian cancer, or a history of previous breast biopsies. Finally, if you have a strong family history with multiple first-degree relatives, that's a mother, sister, or daughter with breast or ovarian cancer, you should share this vital information with your healthcare provider so your risk can be calculated. You may need to begin screening before the age of 40. All women should have a discussion with their healthcare provider by 30. I cannot overemphasize the importance of screening. When breast cancers are found early, before spreading to neighboring lymph nodes or distant organs, survival is over 90%, regardless of race. Early detection has saved thousands of lives. However, an equally exciting and arguably greater concept is the prevention of breast cancer. There are healthy lifestyle habits you can engage in right now to reduce your risk. For example, research indicates that you can reduce your risk by maintaining a healthy weight. Do you remember what you weighed as a young adult right after high school? Research shows when we engage in weight creep, each year gaining a pound or more, this weight gain increases our risk for breast cancer later in life, after menopause. So the goal is to maintain a healthy weight throughout your adult years. And if you are overweight, work on safe strategies to reduce your weight. Exercise can help shed pounds and also reduce your risk. Many studies have shown that moderate to vigorous exercise is linked to lower breast cancer risk. The goal is to exercise at least 30 minutes a day, 5 days a week. I love that this recommendation is moderate intensity, consistent with purposeful walking at the park, gym, church grounds, or neighborhood, and you can start today. Finally, exciting research recently published confirms again that a diet rich in vegetables and fruits, like that found in a Mediterranean diet, may lower the risk of breast cancer compared to eating small amounts of fruits and vegetables. The recommendation is to consume 5 to 9 servings of fruits and vegetables daily. We are excited to have one of St. Louis's culinary experts, Chef Keith Jones, and Siteman's dietitian, Stacey Brouk, to share healthy tips with Hazelwood young ladies. We are thrilled that the Urban League, Cisco Systems, and BJC have partnered with us to give each Hazelwood young lady a nutritious gift bag of fruits and vegetables. I would call it a healthy living gift. In addition, we thank the Program to Eliminate Cancer Disparities and Siteman Cancer Center for the t-shirts gifted to every high school young lady. These shirts are fantastic, with the front stating Hazelwood Girls Stepping Up for Health. Finally, we are thankful that you have joined the program. Here are the steps to complete. 1, please view the cooking and healthy food presentation by Chef Keith. 2, please complete your risk assessment. You will receive a customized action plan. And 3, please complete our brief survey to enter your student's high school for the grand prize. I wish you health and wellness. And now let's hear from Chef Keith. So Chef, what do we have here?
All right, Lannis, being a 3-time cancer survivor, I always try to do something good for my body each and every day. So a smoothie is the easiest way to get this done. I like to use 3/4 greens, and then I like to use a nice variety of fresh berries. I add banana for sweetness. We have the mint and a healthy dose of olive oil. So I'm going to start blending all this together.
Stacey, why all these fruits and vegetables?
They are a great source of fiber and phytonutrients, which both have been shown to help reduce heart disease risk and breast cancer risk. So the more of these, the better.
Okay, and Chef, those berries look amazing. The raspberries look amazing. How do we incorporate frozen fruits and vegetables? Are they as nutritious?
Absolutely, they can be even better. Those are picked at their peak ripeness and then frozen immediately, so they actually retain more of the nutrients than sometimes the fresh stuff that's been sitting out for a while.
Chef, I just saw you put olive oil in, which is great for the Mediterranean diet, but does it change the taste?
Doesn't change the taste at all, just makes it more healthy.
Right,
Okay.
Great source of monounsaturated fats, which also can help reduce heart disease risk.
Okay,
right.
Got everything in the blender. I'm going to take this off camera and get it blended up.
Okay, so Stacey, do we have to get 5 to 9 fruits and vegetables? What about all fruits?
It's really best to get a good variety of fruits and vegetables. We want to get a variety of colors. The deeper, richer colors have more phytochemicals, which are protective in many ways. We like to get a lot of the yellows and the oranges for the carotenoids, which specifically have been shown to reduce risk for breast cancer.
All right, Chef, I'm curious about the color.
Okay, here it is. And the color is green.
But it looks delicious. And I know all those berries and bananas and mint is in there. I can't wait.
Well, you know, sometimes it's green, sometimes it's red, but it's always very healthy for you.
So we have knocked out 3 to 4 out of our goal of 5 to 9 fruits and vegetables.
Yes, we have. Voila.
So let's move on. Another way to incorporate our 5 to 9 fruits and vegetables in our daily diet is with a salad. Chef, what do we have here?
Well, today the salad is going to include fresh strawberries. And I want to give you a quick tip because I see too many people holding fruit and vegetables in their hands in this manner, which could get your finger cut off. So you want to use your knuckles as a guide. And if the camera is looking at this, I hope they are, we can see how I'm never going to cut my fingers off in that manner.
So knuckles guiding.
Knuckles guiding.
Stacey, this reminds me about fruit juices. Can we get the 5 to 9 fruits and vegetables with 3 cups of apple juice?
Yeah, not the best idea. We don't get all the fiber, we don't get a lot of the nutrients, we get a lot of sugar. Actually, juices can contain just as much sugar as a soda, so you're better off just eating the whole fruit.
All right, Chef, this dressing looks fabulous. What's in it?
Okay, we have a classic raspberry vinaigrette dressing. We have fresh raspberries, balsamic vinegar, olive oil. We like to use 1 part to 3 part olive oil. We have the fresh garlic, Dijon mustard, and just a touch of sea salt in there. So I'm going to go ahead and build this salad. Start with the dressing.
I love this dressing because when I was younger, I used to constantly consume ranch dressing and blue cheese dressing that ruined the nutritional value of the salad. This is a monounsaturated fat with building it with olive oil, which is heart healthy and reduces your cancer risk.
I've also added strawberries, mandarin oranges, which you can buy canned, but not with the syrup, and as well as walnuts. And I always like to drizzle everything with a touch of olive oil.
And I like that the walnuts on there are not candied, so they don't have the added sugar.
This looks delicious. This is our last recipe today. It looks amazing. Chef, what have you made?
What we have here is fresh salmon prepared Mediterranean style.
Okay.
And as you can see, it is loaded with lots of vegetables, olive oil, Kalamata olives, just everything that says Mediterranean.
And I noticed that you were sautéing and not frying. What is the difference?
Well, sautéing is the art of using the least amount of oil to prepare a dish, whereas frying, you're immersing the product into lots of fat, usually not healthy fat.
And I like that you use the olive oil in this instead of butter, Crisco, or lard. You get those monounsaturated fats again, which are wonderful for your heart health.
And what about cooking? How long did you cook the salmon?
So basically 6 to 7 minutes per side, and starting with the flesh side down.
So the skin ends the cooking process.
Absolutely.
Okay. So now we want to bring in our taste testers who have tried all 3 recipes, the smoothie, the salad, and the Mediterranean salmon. Let's bring in St. Louis foodie and social media influencer, Braden Tawaldi, and Fox 2 News anchor and personality, Blair Leday. We already know these are good for you. What did you all think about how they tasted?
I really like the smoothie. I don't personally put olive oil in my smoothies, but you can't really taste it here, and I like the fact that it has a huge health benefit in it.
Yeah, the smoothie was really good. I thought you would have been able to taste the kale and the spinach a little bit more, but you really couldn't taste it. It was great and something I could easily do to start my day off.
Okay, so thoughts on the salad?
All right, so the salad was good, and I love the thought of being able to make a big bowl, like at the beginning of the week. That way I can take it throughout the week for like a meal prep.
I agree, and I learned a new trick about how to cut my fruit, and also I love the raspberry dressing.
Last but not least, the Mediterranean salmon.
I love the mix of vegetables blended in with the salmon. It was seasoned to perfection and very flavorful. I really like the fact that I can pack it up, to go and have it to reheat the next day for lunch.
Right, definitely so. I love the flavor of the salmon, and I do love fried chicken, but this was so juicy, this salmon. It was delicious. It seemed easy enough for me to make at home.
Thank you so much for inviting us here today. I really learned a lot. Ladies, as a foodie myself, I love all types of food, but I know it's so important to fuel my body with the right stuff. I hope you take some time and some of the advice today and find ways to make sure you're getting in all those fruits and veggies.
And make sure to go home and tell your sisters, your moms, your grandmas, all of your other female relatives, you have bright futures, and we want you all to live strong and healthy lives.